This medicine is for treating intense pain. Morphine is in a group of drugs called opioid analgesics. It acts in the brain to alter how your body perceives and reacts to pain. Duramorph Ampul is a medication that can be given by injection into a vein, muscle, or under the skin, depending on your specific product. It's important to use this product exactly as directed by your doctor and to read and learn all of the manufacturer's instructions for preparation and use. If you have any questions about using this medication properly, consult your doctor or pharmacist. Preservative-free morphine may also be given as an injection into the area around the spinal cord or into the fluid-filled space that contains the spinal cord. This is usually done in a hospital setting, where you can be closely monitored. If your doctor directs you to continue using this medication at home, it is usually given as a continuous injection using an infusion pump placed under your skin. The dosage of Duramorph Ampul is based on your medical condition and response to treatment, and for children, the dosage may also be based on weight. It's important not to increase your dose, use the medication more often, or use it for a longer time than prescribed. Pain medications work best if they are used when the first signs of pain occur. Before using Duramorph Ampul, check the product visually for particles or discoloration. If either is present, do not use the liquid. Before injecting each dose, clean the injection site with rubbing alcohol. If this medication is given into a muscle or under the skin, it's important to change the location of the injection site with each dose to avoid problem areas under the skin. Learn how to store and discard needles and medical supplies safely. If nausea occurs, consult your doctor or pharmacist for ways to decrease it, such as lying down for 1 to 2 hours with as little head movement as possible. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. Your doctor may lower your dose slowly to prevent withdrawal. Tell your doctor or pharmacist right away if you have any withdrawal symptoms. When this medication is used for a long time, it may not work as well. Your doctor may need to increase your dose or change your medication. Though it helps many people, this medication may sometimes cause addiction, especially if you have a substance use disorder. Use this medication exactly as prescribed to lower the risk of addiction. Tell your doctor if your pain does not get better or if it gets worse. Common side effects of Duramorph Ampul may include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, increased sweating, or dry mouth. You may also experience pain, redness, or swelling at the injection site if the medication is given into a muscle or under the skin. If any of these effects persist or worsen, be sure to inform your doctor or pharmacist. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so be sure to ask your pharmacist which type is right for you. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, vision changes, slow/fast heartbeat, severe stomach/abdominal pain, or signs of your adrenal glands not working well. Seek medical help right away if you experience very serious side effects like slow/shallow breathing, fainting, severe drowsiness/difficulty waking up, or seizures. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. And remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Duramorph Ampul has a risk for abuse and addiction, which can lead to overdose and death. It may also cause severe breathing problems. To lower your risk, your doctor should have you use the smallest dose that works, and use it for the shortest possible time. Ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose. Teach your family about the signs of an opioid overdose and how to treat it. Keep this medicine in a safe place to prevent theft, misuse, or abuse. Before using this medication, women of childbearing age should talk with their doctors about the risks and benefits. If you are pregnant, use this medication only when clearly needed. It may slightly increase the risk of birth defects if used during the first 2 months of pregnancy. Also, using it for a long time or in high doses near the expected delivery date may harm the unborn baby. Tell the doctor right away if you notice any symptoms in your newborn baby such as crying that doesn't stop, slow/shallow breathing, irritability, shaking, vomiting, diarrhea, poor feeding, or difficulty gaining weight. Before using Duramorph Ampul, talk to your doctor or pharmacist if you have any allergies, or if you have a history of brain disorders, breathing problems, gallbladder, kidney or liver disease, mental/mood disorders, substance use disorder, stomach or intestinal problems, pancreatitis, difficulty urinating, or if you are pregnant or breastfeeding. This medication may cause dizziness or drowsiness, so avoid alcohol or marijuana. It's important to let your doctor know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, and it may harm an unborn baby if used during pregnancy. It also passes into breast milk, so consult your doctor before breastfeeding. Remember to check the label of all your medications to see if they could interact with Duramorph Ampul. This drug may interact with certain pain medications, naltrexone, and samidorphan. It can also increase the risk of serious side effects if used with other products that cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and antihistamines. Make sure to inform your doctor and pharmacist about all the products you use. And don't forget to ask your pharmacist about using other drowsiness-causing products safely. Lastly, this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are using Duramorph Ampul. If someone has taken too much Duramorph Ampul and has serious symptoms like passing out or trouble breathing, give them naloxone if available, then call 911. If the person is awake and has no symptoms, call a poison control center right away. Symptoms of overdose may include slow/shallow breathing, severe drowsiness, coma. It's important to remember not to share your Duramorph Ampul with others, as it is against the law. This medication has been prescribed specifically for your current condition, so it's not recommended to use it for any other condition unless directed by your doctor. In that case, a different medication may be necessary. If you take Duramorph Ampul regularly and forget a dose, take it as soon as you remember. If it's close to the time for your next dose, skip the missed dose and take the next one at your usual time. Don't take a double dose to make up for the missed one. Be sure to store Duramorph Ampul at room temperature and away from light. Different brands or packaging may have different storage requirements, so make sure to read the package labeling or ask your pharmacist for specific instructions. Always keep medications out of reach of children and pets. Do not flush Duramorph Ampul down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.